Doctors and scientists are learning more about hereditary illnesses and are developing all kinds of tests to help us find out if we carry genes for things like cancer, heart disease, diabetes. But not everybody wants to know. In fact, some say they don't want to live their lives worrying about a gene that may or may not turn into a deadly disease. Joining me now is Professor of Epidemiology at the College of Medicine Mayo Clinic, Dr. Gloria Peterson, and CEO of Vital Springs Technology, Dr. Sreedhar Potarazu. And Dr. Peterson, let me start with you because I saw an article about the fact that there's this ethical dilemma about once you know that somebody has something, should you, as the doctor, tell them? And apparently a lot of the material that you get for gene testing is sent to you anonymously or in a way that they don't want to know.
That can be the case. For the research that I conduct, actually, I approach the patient at the time that they come to the clinic. I consent them into a research study. I collect a blood sample from them, but because of the nature of my work, I have to basically accrue and let the number of samples build up in order to have a meaningful finding. So because of the kind of cancer that I study, which is pancreatic cancer, patients are deceased long before I have an opportunity to get a meaningful study sample. And so then when I study it, they're not in the picture anymore, but I am now sitting on a result that could have meaning for their family members.
Exactly, and that's the question.
Possibility does exist.
That's the question. What happens when you approach the family members? What do they say? I want to know, I don't want to know? Which is it?
That is actually the perfect purpose. That's actually perfectly the question that our research study is that we have. There is actually very little guidance from regulatory or from ethical thought about this arena in which we can figure out how to tell people who are really not the research subject about their genetics that they never even, they weren't even involved in the research, but we actually know something about them. And so our research project is to study that.
Dr. Potarazu, what are the ethical dilemmas here? Because do you call somebody and tell them you really do need to know this? They say, I don't want to know, or do you have to sell them on it?
Well, so we have a responsibility as a doctor when we take our oath, right? First, do no harm.
Yes.
So the issue of family history in any patient's evaluation is such a big deal, so that in this situation, as Dr. Peterson said, even if the individual is deceased, I believe that there's a responsibility to inform the family of something that could have material impact to individuals who are still surviving.
But let me give you two scenarios. One is you find out that I may have a gene. My father had a gene that is a disease that I might get, but you have something that can cure it or a medicine that will keep me from getting it. That's one scenario where that would be good news.
Right.
On the other side, you say, no, your father had something that killed him and it's probably going to kill you too, and we don't have anything to solve it. Then what do you do?
Yeah, well, then there is the dilemma, but I think that the doctor still has a responsibility in this particular case of informing. There may or may not be options, but remember that in any situation, if I have a patient in my examining room, I may or may not have particular treatment options, but I can't choose to disclose based on whether I think there's an option or whether the option is going to work. And you have a responsibility to disclose that. It's going to be up to the family and the individual to decide if they ultimately want to know or not.
So, Dr. Peterson, the idea of getting more people to do gene testing, is it a good idea? Are you encouraging us to go out and get our genes tested so we know what possibly could happen to us?
I think gene testing is a double-edged sword. We now know so much about genes. Genes that often these genes have no clinical consequence for the patient. There's no health implication on a number of these genes, I don't think it is worth doing genetic testing for those. On the other hand, there's another whole group of genes where we actually have a great understanding of the condition, of the relationship between the gene and the probability that someone will develop disease, that in fact genetic testing would be indicated. I do agree there.
All right. But what about the idea of my data? Will my insurance company get the data? Will my insurance company then tell my employer or prospective employer that this guy may not live that long?
Yeah, you know, that's a real issue. You know, we're pushing in the current law for more data transparency, right? We're getting doctors to implement electronic medical records so this kind of information becomes available and that people can share it. But the double-edged sword to that is, have we put in place the mechanics and the regulations to know who really owns the data? With whom are you allowed to share the data? There's a lot of unknowns right now where we, in some respects, have put the cart before the horse. So let me give an example. You know, there's this big buzz about, you know, people wearing these fuel bands or exercise bands to monitor, you know, how far you're exercising, or heart rate monitors. Right. So who owns that data? Are you the individual, the owner of that data about whether you're working out enough or you're not? Or is it the brand, and I won't mention the brand, but are you the athletic brand today that...
But we also give Visa our information every day too. So, and Visa owns the information about where I go, what I buy. They know all of that. But this ethical debate is going to continue on. Dr. Peterson, thank you very much. Dr. Potarazu, thank you very much. This story is not going to go away. It's only going to get bigger. Thank you.